LipiFlow is an advanced treatment for dry eye. It's been around for nearly 10 years, and although its indication for treatment for meibomian gland dysfunction is a simple one, there are a few questions around patient suitability. Which patients are most suitable for the treatment? Which tests to use to monitor the treatment outcomes? When you can expect those improvements to take place? And how long you can expect those improvements to last for? Questions such as this, among other questions, I'll be going through and answering in this video with you today. LipiFlow uses proprietary thermal pulsation technology, which is effectively a heat that pulsates. It's indicated for meibomian gland dysfunction. It's unique in that it applies the heat on the inside and the outside of the eyelid and maintains that heat at the optimal temperature of 42.5 degrees Celsius. The other thing that makes it unique is that it applies the treatment on both the upper and the lower lids. Studies have shown that LipiFlow is less effective in more severe gland loss. So in patients where you have a lot of gland dropout, you can expect that the treatment is not going to be as effective as when you have a patient that has a lot of healthy and functioning glands. This is a good tip because it helps you sort of determine when you can expect a good outcome and when the outcome is not going to be that impressive. The official success rate for LipiFlow is 86%. This is based on a study where the participants were given the choice of having a second LipiFlow treatment, and after 12 months, 86% of those participants chose not to have any additional treatment. What you have to remember is this is an average, and it depends on a large number of participants. In your clinic, you're just going to have one patient, and you need to counsel them on what they expect from the treatment and whether that expectation is going to be realistic. Although LipiFlow is a very impressive treatment, you actually get even better results if you combine LipiFlow with traditional treatment like warm compressors. This has been shown in studies and it has been scientifically proven. So it's always good to get your patients in a continuous habit of doing your conventional treatment in addition to their annual treatment with LipiFlow. A question I get commonly asked by my patients is, if I have this LipiFlow treatment, will my meibomian gland dropout improve? Although there's some weak evidence that's shown that you can get an improvement in meibomian gland dropout, there are stronger studies that have shown that you get no improvement whatsoever with LipiFlow in terms of your meibomian gland dropout. So at this stage, we need more studies in this area to be able to say conclusively that LipiFlow improves meibomian gland dropout. Another question I get frequently asked by my patients is, when will I start to notice improvements in my symptoms after I've had the LipiFlow treatment? So studies have shown that your symptoms start to improve 4 weeks after you first have the LipiFlow treatment done, but we don't expect the tear film to stabilize until about 3 months. That's when the studies have shown that you get an improvement in your tear breakup time. LipiFlow is one of the few dry eye treatments that's been shown to have prolonged, long-lasting effects. In terms of symptoms, improvements have been shown to last from 1 to 3 years. Meibomian gland function, in terms of the secretion of lipids, has been shown to last up to 3 years. Tear breakup time, which is your tear film stability, has been shown to last up to 12 months. A question that you may be asked by patients is there a benefit to repeating a LipiFlow treatment within the first 12 months? Studies have shown that there is no benefit to repeating LipiFlow within the first 12 months following treatment. After 12 months, there probably is a benefit, but if you're still within the 12-month period, I wouldn't recommend repeating the treatment. LipiFlow is a very useful treatment to give to patients that are going to undergo cataract surgery. Studies have shown that treatment with LipiFlow stabilizes the tear film after the surgery and helps to stabilize the refraction before the surgery, which leads to more accurate surgical outcomes. LipiFlow is a very safe procedure. Studies have shown that patients only get very mild discomfort, and that's normally associated with the actual insertion of the activators prior to getting the treatment done. The reason for this is patients have different eye sizes, so patients with smaller eye sizes, you might find that it's a little bit harder to get the activator in. But the good news is, once those activators are in, patients are normally very comfortable with the treatment once it starts.